The month of January, from 1st to 31st, is the World Cervical Cancer Awareness Month. And the theme for this year 2024 is Learn, Prevent and Screen. World Cervical Cancer Awareness Month is a global healthcare event observed for the entire month of January every year. It's aimed to raise awareness of cervical cancer globally. In this episode of Pink Word Matters, we would be simplifying cervical cancer, so we can understand what it is, how to prevent it and the treatments. Please watch till the end.
5.
Anyone with a cervix is at risk for cervical cancer.
3.
Although it occurs most often in women over the age of 30.
Time's up.
Untreated or poorly treated infections with certain types of human papillomavirus HPV is the main cause of cervical cancer. Human papillomavirus HPV is a common virus that is passed from one person to another during sex. At least half of sexually active people, particularly those who practice unprotected sex, will have human papillomavirus at some point in their lives, but few will get cervical cancer. Cancer is a disease in which cells in the body grow out of control. Cancer is always named after the part of the body where it starts, even if it spreads to other body parts later. When cancer starts in the cervix, it is called cervical cancer. The cervix is the neck region of the uterus. It connects the uterus to the vagina and provides a passage between the vaginal cavity and the uterine cavity. The uterus is where a baby grows during pregnancy. There are several other cancers that affect women's reproductive organs. They are called gynecologic cancers. The 5 major types are cervical cancer, ovarian cancer, uterine cancer, vaginal cancer, and vulvar cancer. There is also the fallopian tube cancer, which is the 6th gynecologic cancer, but this is a very rare type of cancer. Of all these gynecological cancers, only cervical cancer has screening tests that can detect it early, and treatment can be most effective. According to the World Health Organization statistics, cervical cancer is the 4th most common cancer in women globally, with an estimated figure of 604,000 new cases and 342,000 deaths in 2020. It is important to note that it takes 15 to 20 years for abnormal cells to build up and become cancer. But in women with weakened immune systems, such as untreated HIV, this process can be faster and take 5 to 10 years. Women living with HIV are 6 times more likely to develop cervical cancer compared to women without HIV. It is also important to note that the highest rates of cervical cancer incidence and mortality are in low and middle-income countries. This reflects major inequities driven by these 3 factors. 1. Lack of access to national HPV vaccination. 2. Cervical screening and treatment services. And 3. Social and economic determinants. Since cervical cancer can be treated effectively when detected early, it is especially important to recognize warning signs and learn if there are things you can do to reduce your risk. Cervical cancer can be cured if diagnosed and treated at an early stage of the disease. Recognizing symptoms and seeking medical advice is hereby very important. Women are advised to see a healthcare professional if they notice any signs or symptoms. The common signs and symptoms includes unusual bleeding between menstrual periods, unusual bleeding after menopause, or bleeding after sexual intercourse, increased or unusual vagina discharge or foul-smelling vaginal discharge, persistent pain in the back, legs, or pelvis, swelling in the legs, unexplained weight loss, fatigue and loss of appetite, vaginal discomfort, etc. But the most preemptive step to take in the fight against cervical cancer is the vaccination. As a priority, HPV vaccines should be given to all girls aged 9 and 14 years, before they become sexually active. Women that are 30 and above should endeavor to be screened for HPV, where the screening shows positive. Treatment should commence immediately. Remember, it is early detection and treatment that ensures the cure. Other important ways to prevent HPV infection is to avoid smoking, as smokers are more prone to getting the disease. The use of condoms as protection is also very effective against contacting the human papillomavirus. In conclusion, all women, all over the world, are hereby advised to seek out the cervical cancer center closest to them in their country and community to get screened for cervical cancer, at least once every 5 years. Women must not wait to get signs and symptoms before they seek medical attention. And for women that has suspected signs and symptoms already, they should not shy away from seeking medical help, but must endeavor to commence treatment immediately. Remember, cervical cancer can only be cured when detected on time. And as it is said, a stitch in time saves 9. Younger women of ages 9 to 14 should endeavor to get vaccinated against the human papillomavirus. Follow Pink Ward Matters on Facebook, TikTok and Instagram for more information on women's health. Subscribe to our channel on YouTube, and don't forget to like and press the bell button to get notified of our next videos. # World Cervical Cancer Awareness Month. # Pinkward Matters.